check the mini bag for you. First thing I'll do is I'll check my orders, and it says here I'm going to administer the Roseflin, which is an anti-infective that binds to the cell wall, causing death. Contraindications will be allergies to cephalosporins, with side effects of nausea, vomiting, headache, and a rash. I would look at renal labs, BUN, and creatinine. A normal dose is 1 to 2 grams per 12 to 24 hours. I would watch for anaphylaxis and infection. The order calls for 1,000 milligrams of meds added to 500 milliliter of IV solution. The doctor's order is for 50 milligrams per hour. So it will be at 25 milliliters per hour. And here is the dosage calc, if you can see. Hope you can see that. Okay. So then now I am going to swab the top of my bottle here, and I'm going to draw some air and insert and draw my meds. And now I'm going to add this to my IV bag. Be careful not to puncture the bag. I'm going to insert that. I'm going to put my needle into my sharps. Okay, while I'm here, I'm going to go ahead and label my bag and my tube. For my bag, I'll want to have the patient's name, the drug, the dose, the time, and initial, and I'll label the bag here, and then I will do also my tube, which I'd want to do time, drug, initial, and so let me go ahead and get this. Untangle there, sorry. I'm going to go ahead and connect this. Okay. So I'm going to grab this. Oh, I need to prime my drip chamber, so I'm going to go ahead and squeeze this and prime it. Okay, so I'm going to take this syringe of saline, and I'm going to go ahead and go to the patient's room. Knock, hello, my name's Erica, and while I'm introducing myself, I'm going to go ahead and do my hand hygiene and apply my gloves. And I'm going to identify the patient. Hello, could you tell me your name and your date of birth? And I'll compare this to the patient's band. And everything's good there. Then now I'd want to check the IV site for any phlebitis or infiltration. There's no redness, heat, or swelling. It's not cold or clammy or pale. So everything's looking good. I would ask the patient for any allergies, which I would also check that on the doctor's report, on the patient's report, for any allergies. And I'll explain the procedure to the patient that the doctor has ordered Roseflin for you. And so I'm going to hang this bag here. And I will use my alcohol wipe to clean this here. And I'll need to flush. So I'm going to get my syringe here. And I'll aspirate and flush the line. Then I would attach this here. Oh, I would unlock this and then flush the line, clamping it, then attaching the tubing in, and release this so that the Roseflin can go to the patient. Just to be attached like that. Okay. So now that all of that is done, let's see. I would, already connected the piggy. Set the flow rate on the machine and recheck and see how it's doing, if there's been any filtration or anything like that. And then I would get ready to document. So I would go ahead and remove my gloves and wash my hands, and I would document the patient's tolerance, how many attempts I had to do, the IV site, the drug dose, input, outputs. I think that's everything, and just observing that everything is going well. Then I believe I'd be done. And then when the bag is empty, I would come in and check, wash my hands and put gloves again, reassess the site, and then if everything's going well, I would clamp this and then disconnect, and flush it again, and that would be it.